With the honourable member for Edmonton Meadowlark, Leader of the Liberal Opposition.
Thank you, Mr. Speaker. This is lonely at the top, but in the case of AHS, it's busy too. A summary of the past 3 years. CEO Stephen Duckett was replaced by Dr. Eagle, who was recently replaced by Duncan Campbell, who has now been replaced by 2 new co-CEOs. These new co-CEOs report to AHS Administrator John Cowell, who replaced new Deputy Minister Janet Davidson, who back in June replaced Chairman Stephen Lockwood and the entire Board of Directors. Mr. Speaker, to the Premier, that's a lot of people getting hired and fired. Have you ever considered that maybe your real problem is that fellow over there, your minister?
Mr. Speaker, I find that absolutely amazing coming from the honourable member who stood in this House time and time again and lectured us on how we needed to make changes at the top at Alberta Health Services, Mr. Speaker. And as I said before, we are committed to ensuring that frontline staff and patients in the healthcare system get the best possible services. There is no doubt that we continue to make improvements. We will continue to do that, Mr. Speaker, and we're really pleased to know that the honourable member thinks that this is a helpful step.
Mr. Speaker, I have lectured this government time and again, as every other healthcare provider, on how to fix healthcare.
Exactly.
As you can see, there are many bodies under the bus, Mr. Speaker, and now the minister has only 2 people left to throw under the bus: the AHS administrator and the deputy minister. Interestingly, both have produced reports on AHS governance, 2 very different reports. Dr. John Cowell says, let the system stabilize before making any changes. And Janet Davidson's report says, don't wait, make more changes now. To the minister, to help Vegas bookies lay correct odds on who will be thrown under the bus next, can you please tell us whose recommendations you plan to follow, your AHS administrator or your deputy minister?
Mr. Speaker, what we plan to do and what we will continue to do is to put patients first and put frontline healthcare staff first in this health. And if the honourable member wants to interest himself in reports and recite chronology, that's entirely up to him. But as he well knows, Mr. Speaker, this government took a very direct stand early in our mandate that we were going to provide more direct oversight over healthcare in this province. We hired an official administrator who has become, thankfully, the deputy minister, who pointed out to us quite rightly that the organizational structure there was not aligned with frontline staff and needed to do a better job of supporting them. Thank goodness, Mr. Speaker, the leadership is in place now to make this happen.
Mr. Speaker, this minister's idea is putting patients first, is putting them into overcapacity beds, where after a surgery they wait for 6 days on the emergency gurney. With broken ankles, they wait for more than 7 days to get them fixed. Yeah. The bottom line is this: the constant chaos in AHS has left our healthcare system in disarray. Yeah. We constantly hear reports of people waiting far too long for care that they need. And speaking of waiting, Mr. Speaker, the AHS first quarterly report, a wait times report, is now 78 days late. While the next quarterly report is due in 13 days, this quarterly report is a quarter late. How bad can it be, Minister? Will you please tell us, will we get this before the Premier's...
Mr. Speaker, all you have to do to figure out how bad it can be is to look at a member of this Legislative Assembly who is a physician, who would constantly stand up and undermine the work of frontline healthcare workers and undermine the performance of a system that is the envy of every province in this country. Mr. Speaker, we have made a commitment as a government to exercise oversight, to maximize all of the opportunities that are available to us through a single delivery system. We are leading in areas like access to bone and joint surgery in the province. We are leading and holding our own against the national average in many others, despite 140,000 people coming here last year.